Hello everyone. Thank you so much for joining this webinar today. My name is Bob Gerlach. I'm the Health and Welfare Benefits Manager here at Westpath. And today I'm going to talk about the 2024 plan changes, specifically the change from the Bronze HSA plan, the H3000 plan, to the new H5000 plan. This webinar is designed for people currently in the H3000 plan. If you are not currently in the H3000 plan, feel free to still stay on and learn. If you're in one of the other HSA plans, we did record webinars on those already, and they will be posted in the next couple of days. And if you are not in an HSA plan and instead in one of the other plans, or if you want to learn about all the other HealthFlex plans we do have a webinar coming up this Thursday that's going to talk about all the plans. The objectives for today are first for you to learn about the 2024 HSA plan changes. And I want you to confidently understand how the new plan, the new Bronze H5000 plan, compares to the H3000 plan that you're likely in today. And then also want to make sure that you're prepared to make your 2024 HealthFlex elections. So why are we changing all of our HSA plans now? Each year, the IRS sets a minimum deductible that HSA plans must have. In 2024, that minimum deductible is going to be $1,600 for an individual and $3,200 for two or more people. Based upon that, if we did not make changes, the H1500 of today would not be compliant in 2024. So we looked at the plans that we have, and we wanted to create a variety of HSA plan options while ensuring that they were all compliant for at least a couple of years. We don't want to change these plans each year. And so we landed on changing all of the plans. The H1500 will be replaced by the H2000, the new H2000. The current H2000 will be replaced by the H2500, and the H3000 will be replaced by the H5000. So as I said, our new Bronze plan for 2024 is going to be the H5000 plan. This plan is the biggest change of all the plans that we have for 2024. The deductible on the H3000 plan today is $3,000 for the individual and $6,000 if two or more people are covered. All the HSA plans today, as well as the H2000 next year, the new H2000, and the H2500 next year, require that the full family deductible be met before the plan pays. The H5000 has a $5,000 individual deductible and a $10,000 family deductible. But it's a deductible-only plan, which means for each individual, only the individual deductible applies, because once you've hit the individual deductible, you've also hit your out-of-pocket max. That means that the coinsurance changes on this Bronze offering for next year as well. The H3000 has a 40% coinsurance that the plan pays once the deductible is met. In the H5000, it says NA here, but it could easily also say 100% because once you meet the deductible, the plan pays 100% because you've met your out-of-pocket max. And then similar to the H3000 today, the H5000 will also not have built-in account funding. So who is the new H5000 best for? The first bullet is probably the one that applies to the vast majority of people in this plan. It's for individuals or families with no major expected healthcare costs or people who are going to most likely meet the out-of-pocket maximum. With the lowering of the out-of-pocket maximum on the H5000 compared to the H3000, now all plans in HealthFlex have the same out-of-pocket max. It's also a good plan for people who have the money and are willing to maximize their HSA contributions. You also have the opportunity to balance having a low premium plan and being able to put money aside if you have unexpected healthcare expenses. And then finally, it's for anyone who's currently in that Bronze H3000 offering and want the closest plan next year to what they have today. So again, the difference is it does have a higher deductible. But if more than one person is covered, the deductible is actually lower because in the H5000, you only have to meet the individual deductible, regardless of how many people are covered. We've lowered that out-of-pocket max again to match all the other plans, making it much easier to compare this bronze HSA plan to the other plans. And then once you've hit that deductible, and meaning you've hit your out-of-pocket max, the plan pays 100% of costs, including pharmacy. Whereas when you met the deductible in the H3000, the plan pays 40% and you pay the rest. And again, neither plan, the H3000 today or the H5000 next year, have account funding unless you get excess premium credit being deposited each month. So which plan is better? If you have less than $3,000 in total claims, the out-of-pocket cost is going to be the same. If your claims fall between $3,000 and $6,300, the H3000 is slightly better. You would pay a little bit less in those scenarios than you would in the H5000. But if you have more than $6,300 in claims, the H5000 will pay more than the H3000 would have, which means you pay less overall. And when we look at people currently in the H3000, about 80% of them are going to pay less in the H5000 than they would today. So really, if your claims are between that $3,000 to $6,300 mark, that's where you're going to want to look to see if the H5000 is still the right plan for you compared to other plans, because you would pay a little bit more than what you otherwise would have paid in the H3000. I'm going to now walk through some actual cost comparison examples to help highlight how the plans are different. This first example is a cardiology outpatient visit with testing. The discounted cost of this service is $1,500. So in the H3000, whether you have employee only or family coverage, so whether you have a $3,000 deductible because you're only covering yourself or a $6,000 deductible because you're covering yourself and other people, you're going to pay that full discounted cost because it's less than the deductible. So you're going to pay $1,500. In the H5000, it's a $5,000 deductible no matter how many people are covered. So again, this service is not going to raise to the deductible, which means you're going to pay the full $1,500. Now let's look at an example of an appendix removal. So the discounted cost of that service is $6,000. In the H3000, with family coverage, the full deductible must be met of $6,000, even though in this case only one person's getting their appendix removed. So you pay the $6,000 to meet your deductible, and you've also met your individual out-of-pocket max. So that person who had their appendix removed in the H3000 today is done. They've met their out-of-pocket max. In the H5000, you need to meet the deductible of $5,000, which you do, but then you've also already met your out-of-pocket max $1,000 earlier than in the H3000. So you're only paying $5,000 for that same service. Now let's look at how prescription drugs pay differently or the same across the two plans. My first example, a generic non-preventive medication. The full price of this generic drug, when discounted by having insurance, is $110 for a 30-day supply and $330 for a 90-day supply. In the H3000, you need to meet the deductible before the plan pays, so you pay that full cost until you've met your deductible. And the exact same is true on the H5000. You pay the full discounted cost until you meet your deductible. Now let's say this same drug happens to be on the preventive drug list. If your medication is on the preventive drug list, You do not pay the discounted cost of the medication. You pay as if you've already met your deductible. So if you've already met your deductible in one of the HSA plans, any of the HSA plans, you pay a $10 copay for a 30-day generic script or a $25 copay for a 90-day generic script. That's in the H3000 today, and it's also in the H5000 next year. To find out if your prescription drug is on the preventive drug list, you can go to welcome.optumrx.com/Westpath, or you can log into Benefits Access and visit the HealthFlex information, and you will find a link to it there. Now let's look at a preferred brand drug. So these are prescription drugs where most often a generic is not available. The full price of this medication is $267 for a 30-day supply and $726 for a 90-day supply. In the H3000 today, you pay that full discounted cost until you meet your deductible. And in the H5000 next year, you would pay that same full discounted cost until you meet the deductible. Much like a generic drug, if it's on the preventive drug list, you pay what you would pay if the deductible was already met. So in the H3000, you pay $65 for that 30-day supply, $165 for a 90-day supply, and you would pay the same in the H5000. In our preferred brand drug class, we have that you pay a 30% coinsurance once the deductible is met, but we also have minimums and maximums. So in this case, 30% of the cost of these drugs is more than the maximum copay, so we only charge you the maximum copay. So you actually pay less than 30% of the cost of the drug. Many of you, if not all of you, are already in the H3000 webinar because you chose to join this one talking about the change from the H3000 to the H5000. So you probably already know some of this, but we think there's a lot of wisdom in choosing an HSA plan. One of the things I definitely want you to take away, regardless of what plan you're in today and what plan you're looking at for next year, is to know that a higher monthly premium does not necessarily make a plan better. Each plan covers the same services and the same doctors and prescription drugs, so the exact same quality. You'll probably not be surprised to know, being in an HSA plan today, that over 90% of people actually save money in an HSA plan. So if you want to continue to save money, or you're looking for additional ways to save money in 2024, when choosing your plan, always consider what it costs to have that plan. For many people who do not meet their deductible, the most expensive part of health insurance is paying to have health insurance. So when you're looking at your total out-of-pocket cost, it's your premiums plus what you pay for your services. If you want to get a better idea of what you've paid for services in the past because you expect to repeat some of those next year, you can log into Benefits Access and get your explanation of benefits, which will show you the cost of that service. And then you can always go in and utilize Alex to estimate your future expenses and get a recommendation for what you should put into your health account. In this case, probably your HSA. Alex is available now. You can log into benefitsaccess.org, click the link, and start estimating your costs for next year and get a personalized recommendation. I've mentioned Benefits Access a few times. Benefits Access now has a whole suite of HealthFlex information, especially to help you prepare for annual election and make your choices. There's personalized information about the plan that you're in, targeted messaging, links to webinars, maybe most importantly, the link to Alex, and it is also where you will go to choose your benefits for 2024. Annual election is going to open November 1st and go through November 16th. The H3000 that you are probably in today is going away in 2024. We do not want you, if you're unable to or forget to make your elections, to be without coverage for next year. So if you do not make elections, we will automatically move you to the H5000 with HSA. That is the plan that is closest to the plan you have today. Any dental or vision elections will carry over automatically, but if you want to make personal contributions to an FSA or more likely an HSA, you will need to log in and make those elections during AE. At this point, you can feel free to type in questions if you haven't started already into the questions module, and I will answer those. We have about 30 minutes, just under 30 minutes of time allotted for questions.
Got one already. For the H5000, does the copay or coinsurance for preventative medications count toward the deductible?
Okay.
Does it count toward the out-of-pocket max?
Okay. So the question is, for the H5000, if it's a preventive drug, does the copay or coinsurance count towards the deductible, and does it count towards the out-of-pocket max? If you are taking a preventive medication that bypasses the deductible, which is what happens in an HSA plan, it does not count towards your deductible. So by rule, the plan requires that you meet your deductible before the plan pays for anything. But when you're getting a copay or coinsurance, because the drug is on the preventive drug list, you're bypassing the deductible and the plan is already paying towards the cost of a medication, in this case, before you meet the deductible. So in that case, it does not count towards your deductible. However, it does count towards your out-of-pocket max. That means that you could, in certain scenarios, meet your out-of-pocket max before you've met your deductible. In that case, the out-of-pocket max trumps it, and you will not need to pay once you've hit your out-of-pocket max.
If one member of a family of 3 hits the $5,000 deductible out-of-pocket max, do the other 2 keep paying toward the remaining $5,000 deductible out-of-pocket max?
So the question is, if you have a household of 3 people, one person hits their out-of-pocket max of $5,000, what do the other 2 individuals do? So the 2 individuals also have a $5,000 out-of-pocket max. So if only one of them utilizes health insurance and has claims, they would need to meet the $5,000. But when collectively all 3 people have met $10,000, then they've met the family out-of-pocket max. So here's an example. Myself, my wife, and my daughter are on the plan together, and next year I will be in the H5000 plan. If I have $4,000 of costs, and my wife has $4,000 of costs, and my daughter has $2,000 of costs, neither of us have actually hit the $5,000 individual out-of-pocket max. But collectively, we've all hit the $10,000, so we're all done for the year. But if I've hit my $5,000, and my wife hits $5,000, and my daughter's had 0 expenses, that also doesn't matter. We've both, 2 of us together have hit the $10,000, so then we have also all hit the out-of-pocket max for the year.
What is the personal HSA contribution limit for 2024?
Okay, what is the personal HSA contribution limit for 2024? I'll just give them all. So for an individual enrolled in an HSA who's enrolled for the whole year, you can contribute $4,150. If you're over 55, you can contribute an extra $1,000, which brings it to $5,150. If 2 or more people are covered, the family IRS limit for contributions to an HSA in 2024 is $8,300. If the primary participant is over 55, they can contribute an additional $1,000, which brings it to $9,350. So the $1,000 additional contribution for being age 55 or over does not change if more than one person is covered on the plan.
Okay, we're just waiting for more questions.
Sure.
Where can people find information about their HealthFlex premiums for different 2024 plans?
Where can people find information about the HealthFlex premiums for 2024? You would reach out to your conference benefits officer or your HR department, and they can let you know what the cost to you is. If you utilize Alex, those costs are actually already built into Alex as well. So when you log into Alex, let Alex know who you are, and estimate what your services are going to be. Alex is going to calculate what your premiums are, what your premium credit is, and let you know what the lowest cost plan for you is likely to be.
Are there age limits to electing an HSA?
Are there age limits that are considered when electing an HSA? So in order to contribute to an HSA, and that includes the money built into the plan, your personal contributions, and any excess premium credit, you must meet the eligibility rules for an HSA. That means you cannot be retired and taking Social Security or enrolled in Medicare Part A or Part B or on TRICARE. As long as you don't hit those, those are the ones that usually make someone in HealthFlex not qualified. If you are concerned or you're not sure if you're eligible, I would encourage you to reach out to EY, who can help you talk through, the eligibility and really your overall, saving strategy, including an HSA.
Just waiting on another question. I think one's coming through. If I'm enrolling in an individual coverage and thinking about the H5000, I cannot contribute 5,000 to an HSA. Can I save the remaining 900 in an FSA? Is that recommended?
Okay, so the question is, if I'm a single individual looking to take the H5000, I can't put the full amount into my HSA because I'm going to exceed the limit. So this is someone under age 55, right? They can only contribute $4,150 for the year. So should I put the rest in an FSA? We have some materials on this, considerations when choosing an FSA along with an HSA. What I'd want to caution you to do is do not put money into an FSA if you're not going to be able to spend the amount that cannot be carried over. So the IRS sets a limit for FSAs each year as to what can be carried over to the next year. They have not yet announced what the limit will be for next year. The 2023 amount to carry over was $610. So if you look at the difference between $5,000 and the $4,150 you can put into an HSA, that's $850. If you put the full $850 into your FSA, based on historical changes in that limit, I think it is unlikely that $850 will be the amount that can be carried over. So you want to at least spend down what can't be carried over. I would recommend contacting EY to see what makes the most sense for you. I am certainly not saying you shouldn't save the full $5,000 if you can, but you'd want to make sure that the FSA was the right vehicle for you versus putting it aside somewhere else.
We're just waiting on another question.
Okay. Please feel free to continue to send in questions. Right now, I don't think we have any that we're waiting to answer. So if you thought you put one in and didn't, check to see if you hit enter, or please type it again.
Please confirm that once the DED or OOP out of pocket,
I got it.
OOP in H5000 are met, there are no further expenses including medication.
Okay, so the question is, please confirm that once the deductible and out-of-pocket max are met, that nothing needs to be paid, including medications. So I will say it as clearly as I can to make sure there's no confusion. Once the out-of-pocket max is met on any plan in HealthFlex, including the H5000, the plan pays for all covered services through the end of the year, as long as they're in network, right? So I'm adding that clarifier there. So, a non-medically necessary procedure would not be covered whether you've met the deductible or not, right? Or whether you met the out-of-pocket max or not. A non-covered prescription drug would not be covered no matter what. So if I decide that I want to, if I get a some type of cosmetic surgery that is not going to be covered, right? If I want calf implants, those are not going to be covered, whether I've met the deductible or out-of-pocket max or anything.
Can you use your HSA savings in the future once you go on Medicare?
Question is, can you use your HSA money once you go on Medicare? Yes. So once you have money in an HSA, as long as it didn't get posted there by accident, that money is yours forever. You can take it into retirement. You can leave it to a beneficiary after you pass. When the money is in your HSA, you can always use it for covered medical services, right? Medical, pharmacy, behavioral health, dental, and vision. When you retire, you can also use it for Medicare premiums. And once you reach normal retirement age, you can actually withdraw that money for any reason. But if you're not using it for medical expenses or healthcare expenses, you would have to pay normal taxes on it at that time.
If I know I want to enroll in the H5000, what do I need to do?
So if I know I want to enroll in the H5000, what do I need to do? I highly recommend that everyone, every year, even if you're not changing plans, utilize Alex, because sometimes things change. Is it likely that if you're in the H3000 today that the H5000 is the best plan for you next year? Yes. Should you spend 20 or 30 minutes going through Alex to make sure you get that personalized recommendation and the suggestion of what you should put in your health savings account? Yes, as well. So I recommend everyone use Alex. It takes about 30 minutes. And I recommend that everyone go in and make an active election during annual election. One, to make sure that, sometimes we even forget what dental and vision plans we're in. Maybe we want to look at those and change those. Also, at the end of your annual election, you get the sheet that you can print out or save that shows what your total costs are going to be. And I always like to know exactly what my costs are going to be for the next year. So I would recommend still going online and making your elections.
What is the out-of-network deductible and out-of-pocket maximum?
So the question is, what is the out-of-network deductible and out-of-network out-of-pocket maximum? Across all plans in HealthFlex, they're double. So the out-of-network deductible in the H5000 is $10,000 for an individual and $20,000 for 2 or more people. Likewise, the out-of-pocket max out-of-network in the H5000 is $10,000 and $20,000. Overall, we have very low utilization of out-of-network services that are impacted by this. The network we use is a very broad network, and the vast majority of people can find an in-network provider. The one spot where we do have a pretty decent utilization of out-of-network providers is on the behavioral health side. However, we know that those networks are notoriously narrow. Therefore, we treat out-of-network behavioral health providers for office visits, counseling sessions as in-network. That means that you pay the same amount you would pay if they were in-network, and we apply it to your in-network deductible and out-of-pocket max.
Does HSA money carry over year to year?
Does HSA money carry over year to year? Yes, it always carries over. It is yours to do with as you choose, but it's only completely tax-free if you use it for healthcare expenses.
Just waiting on the next question. Something's coming. If you're retired and over 65, can you use your HSA for other non-medical expenses? What if you're under?
If you are retired and over 65, can you use your HSA for other non-medical expenses? What if you are under 65? So if you are over 65 and retired, right, because there's a difference there. If you are over 65 and retired, you could use that money for whatever you want. But if you use it for something other than healthcare expenses, you'll pay normal taxes on it. If you are under 65 and you try to use money from your HSA for something that is a non-healthcare expense, you would pay a penalty on that money. So you'd want to reach out to EY before you did that and find out what was the right plan for you for utilization of that money, both before age 65 and after age 65 if you're not retired.
Okay, just waiting on the next question. When can you start using the limited use FSA for costs other than dental
Okay.
vision?
Question is, when can you start using the limited use FSA for costs other than dental or vision? So let me do a little background here. If you have an HSA and an FSA, your FSA can only be used for dental or vision until you've met the IRS defined deductible. I'm going to jump all the way back here so it's on the screen. The IRS defined deductible is the minimum deductible that an HSA plan must have to be qualified. So in 2024, the minimum deductible that must be met is $1,600 for an individual or $3,200 for 2 or more people. So in 2024, you can use your limited use FSA for dental or vision if you have one. And then once you've met $1,600 for an individual or $3,200 for 2 or more people on the medical, pharmacy, and behavioral health side, you can contact Health Equity, provide them the necessary documentation, and they will flip the switch, and then your FSA will start paying first until the end of the year. Now, this is the reason that some people, especially that example earlier of I want to put my full deductible of $5,000 aside, this is the scenario where someone may put that money into both an FSA and an HSA. I will say that unless you are maxing out your HSA, it is unlikely that you would want to use an FSA. And the reason there is for the risk. If you don't spend it, you could lose up to $610 this year, probably be $600 and some dollars again next year. Everything beyond that, you could lose. So if you put $2,000 in your FSA and you only spend $1,000, you're going to lose a few $100s. But if you put that into your HSA, because you hadn't maxed out your HSA yet, that money is yours forever. So the risk of losing it is none.
How do you invest HSA money?
Question is, how do you invest HSA money? HSA investments are handled through Health Equity. They have a full suite of options for you to choose from. Once you have at least $1,000 in your HSA, you can actually go online and designate how much you want in each of the various offerings, and you can invest with as little as $1,000. But note, when the money is invested, it is not able for you to use your card to pay claims or reimbursed. You need to move the money back into the interest-bearing account. When you move the money out of those investments into the interest-bearing account, you will realize gains or losses. So if you put $1,000 in investments, that doesn't necessarily mean you'll have $1,000 when you want to move it back, depending on market fluctuation.
Can you please explain the difference between co-payment and an out-of-pocket expense?
Sure. So the question is, please explain the difference between a co-payment and an out-of-pocket expense. So a co-payment is a type of payment. It is a type of out-of-pocket expense. Co-payments are a fixed cost that you pay for a service. So when we look at our prescription examples here, if you have a generic preventive medication, we have a co-payment for that. So it's a fixed cost that you pay regardless of what that generic drug costs. So that is your expense, and it will go towards your out-of-pocket expenses. When we look at preferred brand drugs, the copay is a little bit different. So for here, this example, for a preferred brand drug, we actually have 30% coinsurance applied, but we have a different copay model, right? It's not a fixed cost. It's a fixed maximum that applies here. So it is a fixed cost, but the cost can change based upon the cost of the drug and the percentage, right? So 30% of the cost of this drug exceeds what we have set the maximum to be. Now, if 30% of the cost of this drug was $50, you would pay $50. But because the max is set at $65, 30% of the cost of this drug is $80-some dollars, so you're only paying the $65 copay. So the copay is the type of out-of-pocket service that you're paying. And copayments are almost always some type of a fixed cost. In this case, it's a fixed maximum cost.
Can I use a custodian other than Health Equity for my HSA?
Can I use a custodian other than Health Equity for my HSA? Any money that comes through salary deductions to HealthFlex, or the money that's built into the plan, or any excess defined contribution must be deposited into the Health Equity HSA. You can reach out to Health Equity for more information on the ability to transfer money in the HSA to another HSA if you have one.
What is the difference between an HSA and an HRA?
What is the difference between an HSA and an HRA? An HSA is a health savings account which can only be paired with an IRS qualified high deductible health plan. An HRA, or health reimbursement account, can be paired with any type of plan. An HRA can only take in plan money. So the only money that can go into an HRA is money that we have built into the plan or excess premium credit if any is available. An HSA can take both of those types of money plus personal contributions. Because the HSA can take personal contributions, the IRS has imposed that limit on it. There is no limit on an HRA, largely because you can't put your own money into an HRA. And then finally, an HSA is yours forever. An HRA is yours as long as you are actively enrolled in HealthFlex or retire from HealthFlex, and as long as you have at least $100 in the account. Once you have less than $100, we will give you 90 days to spend that money down because we don't want to pay fees for low balances.
The primary participant is in a Medicare plan. The spouse has dependent-only coverage and elected an individual HSA plan. Can the HSA money be used to pay for expenses for the participant in Medicare?
Okay. The primary participant is in Medicare. The question, I'm going to lay out the scenario. The primary participant is in Medicare. The spouse and dependent children are on the active plan because they're not Medicare eligible in the HSA. Can the money in the HSA be utilized for the participant on Medicare? As long as the money was in the HSA before the participant accepted Medicare, then yes, that money can be utilized for them. What's going to happen on the other side is if the spouse and dependent child who are on the active plan and not in Medicare are enrolled in an HSA plan, they can put their own money into the HSA plan directly through Health Equity. Because the spouse is not the employee, we don't have a way to have money taken out of their paycheck. So they would contact Health Equity, deposit money into that account for their use only, not for the Medicare eligible participant, because when you're on Medicare, you cannot put money into the HSA, which means that no money put into the HSA after you became eligible for Medicare can be used for you.
Can the HSA be used to pay for health expenses for family members not covered by HealthFlex?
Can the HSA be used for family members not covered by HealthFlex? The HSA can be used for any member of the family who is claimed on taxes, or the spouse, as long as the spouse is not enrolled in a non-HSA plan, or as long as the spouse is not on Medicare or receiving Social Security.
Okay, we're waiting for another question.
And I think I need to clarify, any tax dependent under the age of 19 enrolled in health, any tax dependent enrolled in, any tax dependent under the age of 19. I apologize. If you have a dependent child who is over age 19, but you claim them on their taxes, on your taxes, they cannot use your HSA, but they can open an HSA of their own.
Is the deductible part of the out-of-pocket maximum?
Is the deductible part of the out-of-pocket maximum? In almost every scenario, yes. If you meet the anything that goes towards the deductible goes towards your out-of-pocket max. But remember, a preventive medication copay goes towards your out-of-pocket max, but does not go towards your deductible. And again, that means that you could technically meet your out-of-pocket max before you meet the deductible, especially if you have a lot of pharmacy costs.
Okay, just waiting on the next question.
We have about 3 more minutes available for questions.
No more right now. Wrap up.
Okay. Thank you so much, everyone, for joining today. This recording will be available. We have other webinars upcoming, so feel free to log into Benefits Access and register for those. I thank you all for your time and attention today and hope you all have a great day.